genitourinary imaging test and disorder. Intravenous urography (IVP). IVU, sometimes called IVP, for intravenous pyelography, has been largely superseded by rapid multidimensional CT and MRI with or without a contrast agent. What is intravenous urography? Intravenous urography can help to assess a range of problems. For example, 1. Kidney stone. 2. Urine infections. 3. Blood in the urine. 4. Kidney stone. A stone in a kidney or in the tube, which goes from a kidney to the bladder. The ureter will normally show up quite clearly. For urine infections, if you have infections of your bladder or kidney which come back opening parenthesis recur closing parenthesis daughter and either may help to find if you have a blockage or other abnormality of your urinary tract. For blood in the urine, this can be due to various causes such as infection, inflammation and tumors of the kidney. An IVU may help to clarify the cause. Preparation before intravenous urography. Tell your doctor if you have any allergies, especially allergy to contrast dyes such as iodine. You may be asked not to eat for several hours before the procedure. This ensures that your gut intestines is empty of food, which makes the X-ray picture clearer. You may be given some laxatives to take for a day or so before the procedure. The aim of this is to clear the intestines, which will make the X-ray pictures clearer. You may be asked to sign a consent form to confirm that you understand the procedure. How IVP done? You will be asked to wear a gown and to lie on a couch. Contrast dye is then injected into a vein in your hand or arm. This may sting a little. The dye then starts to filter through the kidneys into the tubes which go from each kidney to the bladder or the ureters. A series of X-ray pictures is then taken over your abdomen, usually every 5-10 minutes. You stay on the couch between each X-ray picture. However, you may be asked to get up to empty your bladder before the final X-ray picture is taken. The procedure usually takes about 30-60 minutes. Some pictures, however, may be taken hours later and certain circumstances. You should be able to go home as soon as the procedure is finished. You can eat normally straight afterwards. Percutaneous antegrade urography. For this, a radiopaque contrast agent is introduced through an existing nephrostomy tube or, less commonly, through percutaneous puncture of the renal pelvis guided by fluoroscopy. Antegrade urography is used in the following circumstances. 1. When retrograde urography is unsuccessful because of tumor obstruction at the bladder level. 2. When large kidney calculi requiring percutaneous surgery must be evaluated. 3. When transitional cell carcinoma of the upper collecting system is suspected. 4. When patients cannot tolerate general anesthesia or the degree of sedation required for retrograde urography. Procedure. This exam may be done in a hospital or in a doctor's office by a radiologist or X-ray technician. To begin, dye is injected right into the kidneys. This allows them to be seen more clearly on X-ray. Retrograde urography. A retrograde pyelogram is an imaging test that uses X-rays to look at your bladder, ureters and kidneys. The ureters are the long tubes that connect your kidneys to your bladder. This test is usually done during a test called cystoscopy. Procedure. This outpatient test is most often done by a urologist in the operating room. General anesthesia is often used. The urologist inserts a long, thin telescope with a light at the end which is called cystoscope going through the urethra. Then they places a tube or a catheter up into the ureter. A dye is injected into the ureters through the catheter. X-rays are then taken of the ureters and kidneys. The test can take 15 to 30 minutes. Risks of pyelography. Pyelography is considered mostly safe. The major risk is a reaction to the iodine-based dye. Minor reactions include hot flashes, nausea, and vomiting. These can often be treated well with antihistamines. There's also a chance of urinary tract infection or pain. In very rare cases, more severe reactions can occur. These includes trouble breathing, low blood pressure, swelling of the mouth or throat, heart attack. Be sure to tell your doctor and the radiologist about your history with allergies. Cystourethropy. A cystourethrogram is an X-ray test that takes pictures of your bladder and urethra while your bladder is full and while you are urinating. A thin flexible tube urinary catheter is inserted through your urethra into your bladder. This technique provides more details than other imaging studies for evaluation of the following: vesicoureteral reflux, urinary incontinence, recurrent urinary tract infections UTIs, urethral strictures, suspected urethral or bladder trauma. Cystourethropy procedure. The patient's bladder is filled with a liquid called contrast material. Then, images of the bladder and kidneys are taken as the bladder fills and also while the patient urinates pees. Angiography. Angiography is rarely used for evaluation and treatment of renal hemorrhage and before kidney sparing surgery. Digital subtraction angiography is no longer used when rapid sequence multidimensional CT or helical CT is available. Angiography procedure. In a coronary angiogram, a catheter is inserted into an artery in the groin, arm or neck and threaded through the blood vessels to the heart. A coronary angiogram can show blocked or narrowed blood vessels in the heart. A coronary angiogram can show blocked or narrowed blood vessels in the heart. A coronary angiogram is a procedure that uses X-ray imaging to see your heart's blood vessels. Medications. Always consult with your primary physician and/or physician requesting this test before discontinuing any medication. Here are some guidelines. Do not take any aspirin or any products containing aspirin. Do not take dipyridamole or warfarin within 72 hours before the test and 24 hours after the test. These medications are often referred to as blood-thinning pills. Do not take Plavix for 5 days prior to the procedure. Take all other medications as usual, especially any medications for on the day of the angiogram. Patients must have a responsible adult driver to accompany them upon discharge and will be verified at time of check-in. Note: procedure may be rescheduled. In the absence of a responsible driver. During the angiogram, you will be asked to change into a hospital gown. The test itself will take approximately 2 to 3 hours. Moderate sedation may be given. During an angiogram, a long slender tube called a catheter is inserted into a large artery, generally in the groin area. The catheter is slowly and carefully threaded through the artery until its tip reaches the segment of vessel to be examined by angiography. After the angiogram, you will be monitored for 4 to 6 hours. At that time, the radiology nurse will discuss at-home instructions with you. You will be provided with a written form of these instructions. A radiologist will evaluate you before you are discharged. Then your physician will discuss the test results with you. If you have diabetes, do not take glucophage or metformin hydrochloride for 48 hours after the test to reduce the risk of kidney complications. Ultrasonography. Medical ultrasound includes diagnostic techniques using ultrasound as well as therapeutic applications of ultrasound. How to prepare for an ultrasound. The steps you will take to prepare for an ultrasound will depend on the area or organ that is being examined. Your doctor may tell you to fast for 8 to 12 hours before your ultrasound, especially if your abdomen is being examined. Undigested food can block the sound waves, making it difficult for the technician to get a clear picture. How an ultrasound is performed. Before the exam, you will change into a hospital gown. You will most likely be lying down on a table with a section of your body exposed for the test. An ultrasound technician, called a sonographer, will apply a special lubricating jelly to your skin. This prevents friction, so they can rub the ultrasound transducer on your skin. The transducer has a similar appearance to a microphone. The jelly also helps transmit the sound wave structures that can be imaged, and common indications include the following: kidneys for hydronephrosis, stones and tumors, bladder for bladder volumes, diverticular and stones, scrotum for hydroceles, spermatoceles, testicular tumors, varicoceles, and for testicular torsion, prostate to measure prostate volume to help assess benign prostatic hyperplasia or interpret prostate-specific antigen results, and to guide needle biopsy. Penis to help evaluate Peyronie disease. With Doppler.to assess blood flow when evaluating erectile dysfunction. Urethra to measure length and caliber of urethral strictures. After an ultrasound. Following the exam, your doctor will review the images and check for any abnormalities. They will call you to discuss the findings or to schedule a follow-up appointment. Should anything abnormal turn up on the ultrasound, you may need to undergo other diagnostic techniques, such as a CT scan, MRI, or a biopsy sample of tissue, depending on the area examined. If your doctor is able to make a diagnosis of your condition based on your ultrasound, they may begin your treatment immediately. Magnetic resonance imaging. Magnetic resonance imaging is a medical imaging technique used in radiology to form pictures of the anatomy and the physiological processes of the body. MRI scanners use strong magnetic fields, magnetic field gradients, and radio waves to generate images of the organs in the body. How to prepare before an MRI. Let your doctor know if you have claustrophobia. Leave your jewelry at home. Be honest with your doctor. Don't get any new piercings. Don't disregard doctor's instructions. Don't disrupt your schedule. Arrive early. Get prepared. What is the procedure for a head MRI? During the exam, it's important to stay still to obtain the clearest images. Children who have difficulty staying still may need sedation, administered either orally or through an 4-line. Sedation can also be helpful for adults who are claustrophobic. You will lie down on a table that slides into the MRI machine. The table slides through a large magnet shaped like a tube. You may have a plastic coil placed around your head. After the table slides into the machine, a technician will take several pictures of your brain each of which will take a few minutes. There will be a microphone in the machine that allows you to communicate with staff. What happens after a head MRI? After the test, you can get dressed and leave the testing facility. If you were sedated for the exam, staff may move you to a recovery area until you wake up. A radiologist will analyze your MRI images and provide your doctor with the results. Your results will be available quickly if your head MRI was an emergency procedure. Radionuclide scanning. A radionuclide scan is an imaging technique that uses a small dose of a radioactive chemical isotope called a tracer that can detect cancer, trauma, infection, or other disorders. In a radionuclide scan, the tracer either is injected into a vein or swallowed. What preparation do I need? It is usually very little. It will depend on which type of scan you are having. Your local hospital should give you specific information. To help you prepare for these tests. For some types of scan, you may be asked to drink to help to flush the radionuclide through your body. For some types of scan, you may also be asked to empty your bladder of urine before the scanning begins. For some scans, such as thyroid scans, you may be instructed to stop certain medications for some time before the scan. As these tests involve a small amount of radiation, pregnant women should not have them. What happens after a radionuclide scan? Radionuclide scans do not generally cause any side effects. Uncommon side effects from radionuclides may include flushing, racing heart, and nausea, but these are short-lived because they are flushed out of your system quickly. Through the natural process of radioactive decay, the small amount of radioactive chemical in your body will lose its radioactivity over time. It may also pass out of your body through urine or poo during the first few hours or days following the test.